Now we'll talk about diverticular disease. This disease is classified as either diverticulosis or diverticulitis. Diverticulosis is characterized by multiple outpouchings of the bowel mucosa. This disorder occurs most often in the sigmoid colon. Diverticulitis, a complication of diverticulosis, is characterized by inflammation or perforation of the diverticulum. What are some of the risk factors for diverticular disease? The most common ones are age over 50, stress, and a diet low in fiber. Diverticular disease develops when undigested food particles and bacteria are trapped in the diverticula, creating a hardened mass called a fecalith. The fecalith creates inflammation, which spreads to the surrounding mucosa. The resulting edema blocks off the inflamed area and restricts its blood supply. As a result, the diverticulum may bleed and perforate, while the trapped fecal contents may cause intra-abdominal perforation and peritonitis. Diverticulosis rarely produces symptoms. However, when diverticulitis is suspected, you'd take a history of the client's diet and bowel habits and perform a physical assessment. What are the nursing diagnoses for clients who have diverticulitis? Constipation related to a lack of fiber in the diet, diarrhea related to inflammation, pain related to inflammation and infection, and anxiety related to fear of surgery and possible colostomy. Diverticulitis can be managed medically or surgically. The goals of medical management are to allow the colon to rest and to reduce the inflammatory process. Medications used to treat diverticulitis include broad-spectrum antibiotics to control infection, anticholinergics to control bowel contractions, pain medications for severe discomfort, and bulk-forming laxatives and stool softeners to reduce constipation. It is very important for clients who have diverticulitis to rest. Instruct your client to avoid lifting, straining, coughing, and bending. These activities increase intra-abdominal pressure. Dietary interventions are also important. Clients who have severe symptoms are restricted to taking nothing by mouth. Intravenous infusions supply fluids and nutrients. They might also require a nasogastric tube to relieve nausea, vomiting, and gastric distension. When symptoms subside, these clients are allowed clear liquids and then solids. High-fiber foods should be introduced very slowly into the diet. If medical measures fail to correct diverticulitis, the client will require surgical intervention. Surgery is also necessary if the client develops any of the following complications: partial or complete bowel obstruction, perforation of the bowel, peritonitis, fistula formation, or hemorrhage. The surgery of choice for diverticulitis is a colon resection of the involved portion of the bowel. A temporary or a permanent colostomy might be necessary. We will discuss this surgery and the care of a colostomy later in the presentation.